we will look into that only. The ear system is Simba concha and then Cavam concha is inside. All the organs, whenever you wanted to treat, then you should treat to the concha. One is the Cavam concha and then Simba concha. On the lower portion, from here to here, markers. From here to here on the lower portion, this is called as a crux. The crux of the helix, below that to be known as a thoracic cavity. That thoracic cavity, you just look into that exactly. There are the two lungs are existing where the heart is existing. midway between the two organs, two lungs, what is existing? Huh? Heart is existing, right? Midway between the, so one is the right lung and then left lung, the heart is existing. Sir, how to know exactly where the heart is existing? You just look into that is the lower portion. In that lower portion, you put the one drop of the water. You put the 1 or 2 drops of the water. When the patient is lying in this direction, put the 2 drops of the water or the 1 drop of the water where the water stays. That particular area to be known as a heart. That means is the deepest part of the Cavam concha in the depression, that to be known as a cardiac system. Hopefully you understand. Then superior to that heart, then inferior to that heart. Superior to that heart to be known as a lungs, the inferior part to be known as a other lung. Right lung and then left lung. So these both the lungs are existing midway between the heart system. Hopefully you understand where is the heart is existing. So how many of them is clear where the thoracic cavity? Thoracic cavity आप लोगों को मालूम है. So however you are really fortunate, you are here. We try to show you the practical as well. Right. So then come to the crest of the helix. That helix region, that to be known as a 3 organs are existing. How many organs? 3 organs are existing. One organ to be known as a stomach, the second organ to be known as a spleen, the third organ to be known as a liver. How many organs? 3. Crest of the helix. So this is the helix. The helix is coming down. That to be known as a crest of the helix. So the crest of the helix is divided into 3 parts are existing. The anterior part to be known as the stomach, then the middle part to be known as a spleen, the third part to be known as a liver. But where accurately it is existing, let me see. So so this part to be known as a stomach, this part to be known as a spleen, this part to be known as a liver. But however, this is the lower portion to be known as a spleen. Liver is slightly upward direction. Liver is slightly above the crux of the helix. Above the crux of the antihelix is liver also existing, because liver is not the small organ. Liver is big organ. So therefore, the liver is existing superior level and also inferior level of the crest of the antihelix as well. Then superior to that region, this called as a center of the ear. This called as a ear. In this way we can consider center of the ear to be known as a, this is the center of the ear. This is the center of the ear. That also to be known as a 0 point. Let me see where exactly the 0 point is existing, but before that we'll try to complete the internal organs. This internal organs, the liver is existing in the half of the margin of the center of the ear system. Then superior to the ear also liver is existing. After the liver, what is existing? After the liver, what is existing? Yes, here you can see the gallbladder is existing on the right side of the ear. Same on the gallbladder region on the left ear, what is existing? Pancreas is existing. Right side is gallbladder. Left side is pancreas. But there is no gallbladder on the left ear. But only we can recognize is the pancreas. The diabetes patients, normally we treat by using the left ear is advisable, but not on the right ear. Not on the right ear. So now after that, after that, it goes to the, after the pancreas, that goes to the kidney system. That goes to the kidney system. But where it is existing, just below to the, the antihelix, crest of the antihelix. So below that, what is existing is the kidney is existing. Further, it is the ureter is existing. From the ureter, this is only the gallbladder and then pancreas. From here, the kidney. From the kidney, this area to be known as a ureter, but this area to be known as a urinary bladder. After the urinary bladder, this area to be known as a anal region and then rectum. Now further you can have a look where that gets completed. Now the entire region from here divided into two lines. Inferior crust, you divided into two lines like this. Right? Superior line to be known as a liver, gallbladder, pancreas, kidneys, ureter, urinary bladder, prostate gland, urethra, penile organ. So rectum are existing. Rectum is coming both the sides. Now the another line to be known as a, this is as a, the crest of the antihelix. Crest of the helix, this goes to the upward direction. This to be known as a, another one area. That area to be known as a, just below to the there are the two lines in the Simba concha. The half of the line to be known as a other organ. Below the half of the line to be known as a other organ. So these organs to be known as a stomach. After the stomach, you assume the digestive system. So then after the stomach, what it comes? Duodenum. Duodenum is the part of the small intestine. So after this stomach, this is as a duodenum, this called as a jejunum and then ileum. Small intestine get completed. That's connecting to the large intestine. From the large intestine, it goes to the vermiform appendix. From the vermiform appendix, it goes to the rectum region as well. It goes to the rectum where the both the lines is interconnected. That area to be known as a anal region. Have a look of everybody so that you can easily understand where exactly that to be known as a, the internal organs get terminated. So hopefully in the all the organ related disorders, how many organs are existing? One is the lungs, heart, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So all the 11 organs are existing inside the ear system in the hollow. In this hollow, whenever organ related problem, you have to treat here, not on the other places. Hopefully you understand. So also we will see in the practical as well.
Sir, can I request you something?
Yes, please.
Can you share the PPT so that we can see the photos and the color photos what you are putting is very simple.
Yeah, definitely. We'll do that.
Yeah, it's easy to locate the points.
Yeah, sure. We'll do that.
Thank you.
The recordings, madam, it is very clear.
Now, here I would like to show you one important point here you learn, which is really for the day to day. Normally, every day I used to apply this point to most of the patients. Now, here one point is there, that point to be known as a 0 point. The point to be known as a 0 point. So try to understand only the one point. You can use it here, and also I'll show you the vertebra also. Now this is called as a crux of the helix. All of you please have a look in your model. You can have a look. This to be known as a crux of the helix. Right. So this area to be known as a, especially the center of the area of the crust of the helix, that to be known as a 0 point. I keep telling that 0 point is the equivalent to the one important point, that to be known as a chung wan. Chung means is the center, wan means is the stomach. Chung wan point, that is Ren 12. Ren 12 were exactly on the center of the abdominal system, that is the move front alarm point for the stomach. It is existing, that to be known as a influential point for the all the four viscera are regulated by the 1 point, that to be known as a Ren 12, isn't it? When the yang pulses are deficiency, when there is no pulse on the yang meridians, that time you wanted to select 1 point, that to be known as a 0 point. The importance of the 0 point to be known as a balancing point, equilibrium point, brain activity point, and hormone regulating point as well. The female related problem or the male related issues, the hormones to be regulated, the pituitary gland to be regulated, and to calmness, also advisable to use this particular point for making the balancing system. 0 point is whenever you find that there is no pulse to the patient, on that situation it's advisable to use apply the point to be known as a 0 point. Where is that 0 point is existing? Yes.
Center of difference.
This point to be known as a 0 point. This point to be known as a 0 point. Right. 0 point for the overall for the health related conditions, many conditions, and no matter what kind of the disease, when there is a lot of complex diseases are there, so that time you can use the 1 point, that to be known as a 0 point. Once you activate 0 point, then it regulates the yang pulses. When you feel there is no yang pulses are executing on the radial artery, once you apply, recheck once again, then the pulse comes easily. How so beautiful. Ren 12 you just apply, then again you apply the 0 point together, then the yang pulses it comes out, then again recheck, then which pulse is deficiency. 6 pulses we see, maybe 4 pulses may come, 2 pulses may not come. So what are the 2 pulses we would like to recognize, then you treat to the patient. This is the one modality to understand. The second I would like to show you here, that to be known as a, there is a vertebra, that to be known as a vertebra, where is the spinal cord is existing. To treat for the cervical pain, thoracic pain, lumbosacral pain, and coccyx pain, and sciatica pain, where we should treat. But only the one line you remember, the entire line to be treatable by activating to the one particular line we will going to see now, where exactly is located. Now please you just listen. This is do you know where is the tragus and then antitragus, right? This to be known as a tragus in front of the ear, where the small intestine 19 is there, that is in front of the tragus. Opposite to that, this to be known as a antitragus. This to be known as a antitragus. Tragus means is a curved flip. Curved flip. You touch and feel. You touch and feel this. You touch with the thumb and then index finger. You touch and press it. That to be known as a tragus. Then the posterior region, that to be known as a antitragus. You touch and feel there is a hardness is there. So front of the ear, this is as a tragus. The opposite to that, there is the antitragus. In front of the ear, this is as a tragus. This as a antitragus. Right? In this way, so now we antitragus, that to be known as a head region. Antitragus is your head region. I will show you where is the various front head, temporal head, occipital head, parietal head, where it is located on the ear. So when the time comes, I'll try to show you once again. So now we'll see once the brain stem, this to be known as a brain stem completed, then what it starts? Atlas and axis starts, that to be known as a cervical. So from here, the cervical starts from here, then it goes to the cervical vertebra, then further it goes to the thoracic vertebra. From here, it goes to, this is as a cervical thoracic vertebra, this to be known as a cervical vertebra, and from here, this to be known as a lumbar vertebra, this to be known as a sacrum vertebra, this to be known as a coccyx, and this further it goes to the sciatica nerve, that also to be known as a sympathetic nerve as well. ಏನಮ್ಮ ಅರ್ಥ ಆಗುತ್ತಾ ಯಾಕನ?
Yes, sir.
ಅರ್ಥ ಆಗ್ತಿದೆ ಸರ್.
Yes, sir.
ಇಲ್ಲ ಕಿವಿ ಅರ್ಧನ ನೋಡ್ತಾ ಇದ್ದೀರಾ ನೋಡ್ತಾ ಇಲ್ವಾ ನೀವು?
ನೋಡ್ತಾ ಇದೀವಿ ಸರ್ ಪಕ್ಕದಲ್ಲಿರೋರು.
ಯಾರಿದ್ದಾರಮ್ಮ ಪಕ್ಕಾಗೆ?
ಮಗ.
ವೆರಿ ಗುಡ್.
ಮಗ ಸರ್.
Say thanks to him. Whoever sitting next to you, say loudly thanks to your brother or sister or mother or father or anyone who is sitting next to you. From my side, by heartedly I say thanks to them who are sitting next to you. Yes.
ಸರ್ ಅವ್ರು ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ಬೇಕು, ನಾವು ಫ್ರೀ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾ ಇದೀವಿ ಅವ್ರಿಗೆ.
Hey, that's your mandatory to do that, isn't it? That is your duty. Duty to do that. Don't say thanks. You should not. We should say thanks at least with a bearable pain he is sitting next to you. How difficult he is sitting, you cannot imagine, but himself he can understand that. ಇದೇನಪ್ಪ ತಲೆನೋವು ಸರ್ ಭಾನುವಾರ ಆರಾಮಾಗಿರ ಅಂತ ಕಿವಿ ಹಿಡ್ಕೊಂಡು ಕುತ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದಾರೆ ಅನ್ಕೊಂಡಿರ್ತಾರೆ ಅವ್ರು. ಹೌದಲ್ವಾ? ನಿಜ ಹೇಳ್ತೀನಿ ತಾನೆ ನಾನು. ಅವ್ರು ಕೇಳಿ ಪಕ್ಕಾಗಿರೋರು ಹೇಳ್ತಾರೆ ಅವ್ರು. ಸರಿನಾ? ಲೆಟ್ ಮೀ ಸಿ. Now the thoracic cervical related problem where we wanted to treat. So actually ನೀವೆಲ್ಲ ಇಲ್ಲಿ ಬಂದಿದ್ದೀರಾ, ನಿಮ್ಮ ಮಕ್ಕಳೆಲ್ಲ ಬಚಾವ್ ಆಗ್ಬಿಟ್ರು ಫಿಸಿಕಲ್ ಕ್ಲಾಸ್ ಅಲ್ಲಿರೋರು, ರೈಟ್? ದೇ ಆರ್ ಎಂಜಾಯಿಂಗ್ ಅಟ್ ದ ಹೋಮ್. ಸೊ ನಾವು this area to be known as a cervical related problem can be treatable. Sometimes do have the pain on the C4, C5, C6, C7. They do have the pain. You can select in this region. Further on the thoracic region, these days I am seeing the many patients related to the thoracic related problem. That means the muscles which are related to the rhomboid muscles, trapezius muscles, thoracic muscles, they have that spasm, stiffness, rigidity on that region. Sir, itna pakad liya hai, mujhe burning ho raha hai. People says I don't have the burning. Yesterday, literally she is crying, one lady, after my second baby birth, developed this pain. Now still I have the pain. I feel very pathetic situation. I cannot focus on my job. My mother-in-law also sick, but they are coming all together for the treatment, but still she is telling that I have the burning kind of the pain. So that particular time I have treated by using these points as well. Along with that, some of the rhomboid motor points as well. With the electrical stimulation I treated yesterday. I mean to say, you just add up these points as well. Micro acupuncture, macro acupuncture together. One sambar chanagilla andre innond sambar chanagirutte. ಹೌದಾ ಇಲ್ವಾ? ಇಡ್ಲಿ ಒಬ್ಬರಿಗೆ ಇಷ್ಟ ಇರುತ್ತೆ, ದೋಸೆ ಇನ್ನೊಬ್ರಿಗೆ ಇಷ್ಟ ಇರುತ್ತೆ. ಇಡ್ಲಿನೇ ತಿನ್ನೋ ಅಂದ್ರೆ ಅವ್ನಿಗೆ ಇಷ್ಟನೇ ಇಲ್ಲ, ನನ್ಗೂ ಆಗುತ್ತೆ. ಯಾವಾಗ ಚೆನ್ನಾಗಿರೋದಿಲ್ಲ ಆ ಟೈಮಲ್ಲಿ ತುಂಬಾ ಸಂತೋಷ ಬೀಳ್ತೀನಿ. ಹಾನೆಸ್ಟ್ಲಿ ಐ ಆಮ್ ಟೆಲಿಂಗ್ ಯು, whenever there is the sambar is not good, I feel happy. At least I can take minimum. When it is too good, we take 5 to 10 bites extra. Why? We wanted to give burden to our body, isn't it? So that's the reason I refrain to telling that no salt, nothing is there. I keep quiet. Really good. Have it on that time. When it is too good, right? Then what happened? Why I told this story? Yes. ಹೌದು, ಸರಿನಾ? ಅದಕ್ಕೋಸ್ಕರ you can use it.
To your wife, so.
Hey, don't. Right, now let me see the thoracic vertebra which I told you. You just treat by using this particular line, which will be really helpful to treat for what condition? Thoracic related problem. Then you come to the lumbar vertebra. Most of the patients on the LBP, low back pain, they do suffer that related to the back pain, back spasm, right? Yaw shu. Yaw means back. Yaw means Jamaluddin, Salahuddin. समझ में आ रहा है आपको? Back pain related conditions, you use this point will be really helpful. This to be known as a back region. L1, L2, L3, L4, L5. These are the 5 vertebrae to be known as a lumbar vertebra. Then come to this region. This is the fused bones. This is the sacrum vertebra. From there, this line to be known as a sciatica line. This line to be known as a sciatica line. Sciatica related problem. Right? From where it starts the sciatica pain? From where is the origin?
And so,
Right. Then the radiating pain, right? On the posterior side of the hamstring muscles descends the downwards direction, that the entire line on the till here you can treat for the what condition? Sciatica related problem can be treatable. Right? So hopefully you understand. Sir, how to understand this really? We are dilemma. Then I'll tell you some secret. That secret you will identify the sensitive areas of the points to insert the needle as well. If you do the mistake, then you need not to worry. Then how to understand and select that point? Your ear will give the signal to you that yes, I do have the problem. So I need to treat on that specific region. So that also I'll try to show you in the practically. As of now, you keep it as a macro information, but when you implement as a micro application, how to use the micro needles, Sujok needles, and other also ear needles. Let me see that. Right?
sir, that means these points will be tender when we touch them with probe or toothpick something.
Good. Good. So it will get the tenderness and also some kind of the pain, harshy pain. When the disease is reflecting that affected on the particular region, that we will recognize by using giving some pressure. So we will see that as well. So hopefully you understand. How many of them understood about this particular 0 point and also spine? Two things it is in your mind. Internal organs is in your mind. The second is the spine and then 0 point.